there's titanium or metal in there, not your bones touching one another. There's something called joint receptors in your joints, that where the bones come together, the joint receptors send a message again to your brain to say where you are. My knee's bent, my knee's straight. You know, my knee's strong and stable so that I can stand on one foot. Whereas if that knee's been replaced and you have metal on either side of that joint, you don't have the joint receptors saying, okay, well, you know, we're steady, we're strong, we're straight. And it takes some compensation from your other joints and from your muscles to kind of make up from the fact that you don't have the joint receptors sending those messages anymore. Yes?
Okay, I've had hip replacement on the right side. My left knee has a torn meniscus. Is that going to affect the balance on the left side?
Yes, yeah, the torn meniscus in the knee is going to affect. Do you have any pain from it?
Just occasionally.
Okay. But yeah, if there's anything compromised in the joint, it's not necessarily going to affect the joint receptors like we talked about with the hip replacement, but it is going to affect the stability of the knee.
Okay.
So like all the tendons and ligaments and meniscus and everything that's in the knee is keeping it steady and stable. If anything in there is compromised, if something is torn or pulled, if arthritis is called, you know, bone spurs, anything like that in the joint, then where the joint's not going to be as stable. And if it's not as stable, it's going to move a little bit because it's not held in place well. And it's not going to be that obvious. It's not like your knee's going to necessarily like just bulge out. But that little bit of unsteadiness is going to translate into being unsteady on that foot. And again, it comes down to, if that's not something you can change, then you need to come up with a way to compensate and make everything else stronger. So at the knee, if you have something inside of the knee, like arthritis or something torn, then to compensate for that problem, if it can't be fixed, is that all the muscles around the knee, this part of the leg, this part of the leg, need to be stronger than maybe would normally be necessary in order to stabilize that joint. So that then if all those muscles are stronger, they're holding it in place. When you go to stand on one foot, it's going to hold it and you're not going to have as much of the movement. Okay. Any other questions? Yes?
You spoke about nutrition. How important is water as far as your balance concerned? Balance, is that any effect at all?
Absolutely. In two ways. One, in order for your muscles and your joints to function properly, you need to be adequately hydrated. So in order for all those systems to work, they need water. Your joints need to be lubricated. So water is important in that sense. The other thing about water is that dehydration is one of the #1 causes of dizziness. Because when you don't drink enough water, two things can happen. One, your blood pressure can drop. Does anybody have what they call orthostatic hypotension? When they stand up, their blood pressure drops and they get dizzy. So that's a common thing that happens.
Occasionally.
Yeah, when you're dehydrated and haven't had enough water, is that you stand up and your blood pressure kind of bottoms out. It's just a matter of having enough fluid in the system.
What's adequate?
Enough blood volume. It really depends on the person. Kind of some people say 8 glasses of water a day. Some people use it, say, based on body weight. So if you take your body weight and you divide it in half, so for numbers' sake, let's say if you're 200 pounds and you cut it in half so you're at 100 pounds, for the 200-pound person, they should drink 100 ounces of water a day.
Wow.
Okay, so the person who's 150 pounds, cut that in half, you're at 75. So 75 ounces of water a day. Unfortunately, a lot of things affect that. So you really sometimes have to kind of maybe start there and see how your body responds to it.
An ounce per half pound.
Mm-hmm. Yep.
An ounce is a half a cup. Is that what you said?
No, and 1 ounce per half a pound.
Oh, okay.
Mm-hmm.
So would that lack of water might affect, say, when you get up at night to go to the bathroom, just for a few seconds you feel a little unsteady?
It could be because most of us, our bodies dehydrate overnight. Just naturally, we drink throughout the day, and then at night we're not, waking up every hour to sip some water. So, which you would want to. So naturally you dehydrate. One of the best things you can do is when you first get up in the morning to rehydrate and drink a big cup of water in order to rehydrate. So yes, the unsteadiness when you get up. Sometimes it's really just being a little disoriented though. At night you're maybe not quite awake, and the lights, it being dark affects your balance. That's where the vision comes in. If your vision isn't good, if you can't see clearly, either because your vision's bad or because it's just dark, that's going to affect your balance and how you feel. And that's the most common time that people have falls with an injury is at about 2 o'clock in the morning. And that's because people get up, you're half asleep, it's dark, your body's a little dehydrated, you're feeling a little weak, you're not real alert, you're maybe in a rush because you just woke up and you need to get to the bathroom quickly. And most falls with injury, such as hip fractures and compression fractures in the back, happen between the bed and the bathroom in the middle of the night. And just making sure all the other systems, like I said, that you can control are working optimally is what's going to keep your body from being caught off guard and having a problem at night like that. And ideally, ideally you're not getting up more than maybe once a night to use the
I get up
bathroom.
5 times. Or 4 at least.
If you drink a lot of water, you're going to get up.
Yeah, and there's some strategies you can use in terms of you want to drink more of your water during the beginning of the day and kind of tamper off as the day goes on.
Yeah, they tell you like, if you have problems having to get up to go to bed, like, don't drink any water after 8 or after 7 or whatever, so, yeah, you really have to do heavy during the day.
Yeah, so you really do need to consciously drink more, throughout the morning as you rehydrate from sleep, through lunchtime up until dinner. And then after dinner, maybe if you're taking some, just enough to wash down some pills that you have before bed, but ideally you wouldn't have a whole lot of water in the evening hours because your body will have to get rid of it. The more you put in, the more you'll have to get rid of. And so to avoid the getting up, and it affects your sleep and everything. So it's good to use some strategies to try to decrease that nighttime bathroom breaks as much as you can. Yes, sir.
Ideally, you're talking water, but realistically, does that include all fluids?
It does not include alcohol or caffeine. So alcohol and caffeine are both dehydrating. So the liquid that you get when you consume those drinks aren't going to count towards your water intake. If you have something like some juice or like decaffeinated teas, the water mixes, the flavors that you put in water, those kind of things, those are going to count towards your
What
water.
about the caffeinated coffee?
Decaffeinated, as long as it doesn't have caffeine, it's not going to dehydrate you. So that water will count.
I read that even decaf has some caffeine
Yeah,
in it.
It does still have a little bit.
Yeah.
Yeah, the same with some decaffeinated teas. Usually that's not enough to be dehydrating though. It's usually, I mean, a decaffeinated coffee maybe will have about 5 milligrams of caffeine, whereas a cup of coffee is going to have regular coffee is going to have about 120 milligrams of caffeine. So a big difference. I mean, I wouldn't give my kids decaffeinated coffee because I wouldn't even want them to have that tiny little bit because they have enough energy. But as far as how that's going to affect, your hydration and everything, it's not going to affect most of us all that much unless you're super, super sensitive to caffeine.
Are there any supplements that would affect your balance
What?
in a negative way?
Are there any supplements that would affect your balance in a negative way?
Like probiotic or
Chemotherapy.
Yeah, a lot of prescription drugs or medications, such as you mentioned, like the chemotherapy, those things do very much affect your balance. Most supplements, like you mentioned, that most people take, the probiotics, the multivitamins.
curcumin? What about curcumin?
No, none of those things are going to negatively affect your balance. In fact, a lot of those things are going to benefit your balance. So, for example, the curcumin has an anti-inflammatory effect. So if you consume things that are anti-inflammatory, it's going to decrease the inflammation. For example, everybody knows, like, have you ever had trouble with your knee and it's gotten real big and inflamed? What happens to some people? So sometimes they have arthritis and their knee will swell up big. That's kind of obvious inflammation. However, most of us have kind of a little bit of inflammation that's not so obvious in our bodies, in our joints, in our muscles, and that inflammation negatively affects your balance. It's extra fluid, it's extra liquid. If you have any swelling in your legs and your feet, that's going to affect your balance. But the curcumin helps decrease that inflammation. Yes, ma'am.
I'm getting ready to have cataract surgery, and I've noticed that when I get up, or my eyesight is not that good, and I get dizzy. And does that come from the eyes or that?
Most likely, my guess would be, I can't know 100%. My guess would be that it is coming from the eyes, that when you're standing up, you're not seeing a clear picture. And when you're not seeing that clear picture, your brain's not getting the signal that everything is right in the world. And then that's when it's causing that danger signal, which is the dizziness. Now, if you get the cataracts fixed, you feel like your vision's better and it's still there, then I would assume that it's probably something more in the inner ear. But you really wouldn't know for sure unless you wait and have the vision addressed.
Very interesting.
There's a lot. The thing with balance is there's so many factors. It's not just the one. Unfortunately, you couldn't come tonight. I could say there's this one thing everybody needs to do, and if you do this one thing, you're never gonna have a problem with your balance, and you're never gonna be dizzy again. Unfortunately, it's not the one thing.
What about posture? I mean,
Posture affects your.
work on that? Would that help you balance?
Absolutely. Because our bodies are made to be stacked on top of each other. Our head, over our shoulders, over our hips, over our knees, over our feet. And that's how we have ideal posture. And that's how our bodies are made to balance best. For example, a lot of women, more than you would think, because nobody really talks about it, women who are pregnant oftentimes have a lot of falls. Why? Because their posture is shift from here to here. And then when we're here, we're more likely to fall because we're out of balance. So the same thing happens when even people who carry a lot of weight in their midsection. That's going to affect your balance because that's going to throw off your posture. If you have the most common posture as we get older is the rounded shoulders hunch forward posture. And that also, again, that's moving your body forward, which makes you more likely to fall forward. So any, exercises and things that you can do to improve your posture, to get your shoulders back over your hips, your head back over your shoulders, that's going to help you maintain your balance. So posture is absolutely, 3 things that really go together are balance, posture, and bone health.
And what?
Bone health. So if you have osteoporosis or osteopenia, which is the start of losing bone density, that's going to affect your balance, because that's affecting your bone structure, which holds us up and holds us together. So all of those things kind of work together. Oftentimes osteoporosis in the upper back is what causes that hunched forward posture. And so doing things to address your bone health is absolutely critical to maintaining mobility and maintaining balance. Yes, ma'am?
What do you do for tinnitus? Or first of all, how do you decipher it? What needs to be done, and then what do you do?
Okay. So you're talking about ringing in the ears versus a dizziness.
Well, they go together.
Okay, all right. So sometimes the ringing in the ears needs to be something that you address with an ear doctor, an ENT. Sometimes there is something structural. Sometimes if the tinnitus with the dizziness kind of go hand in hand, oftentimes that habituation that we talked about, getting your body to get used to that signal, because the tinnitus and the dizziness, again, are danger signals. That's your brain saying there's something wrong, there's something not right. And
Well, if it can't be cured, is there anything that you can do to offset it?
offset the balance effects,
Yeah.
just getting every other system, because the tinnitus is an ear problem. So getting every other, getting stronger, getting more stable. For example, in physical therapy, sometimes we'll find that the tinnitus and the dizziness happens more when you're walking along and you turn your head to look at something, kind of that ringing and dizziness will occur.
Mine just hiss all the time.
Is all the time?
Yeah.
Mhm.
If I eat a lot of salt, it makes it worse.
Mhm. Yeah, there are definitely things that,
Prescriptions too.
prescription medications sometimes cause the dizziness. You mentioned, chemotherapy being something, if that's something you've
I
had
had
in the
this
past.
before I started chemotherapy.
Even before that? Okay.
It was an auto accident cause.
Okay, so it might, the other thing is your circulatory system. Your carotid arteries that send the blood flow up to your brain if you have any kind of blockage in your carotid arteries, and that's something that your doctor can test for. They can do scans to see if that's a problem.
Been there, done that.
Okay. So if it's not, if you've tried all of those things, hydration can affect tinnitus. Excuse the 6-year-old. The hydration can affect tinnitus and can make it worse. Sometimes certain foods, the salt, somebody mentions salt affecting it, and that's related to the hydration. So sometimes if you have too much salt, that can dehydrate you and result in the ringing. If it's something that's been persistent and is kind of all the time, and you just, nothing you've tried you seem to be able to get rid of, the best thing that I can tell you is to really work on getting rid of the dizziness, and the tinnitus might not be as much of a nuisance as it was if you're able to get rid of some of the dizziness. If you can retrain your brain, like you said, it was related. Did you hit your head at all related, or have a neck injury related to your auto accident?
Twice.
Okay.
Neither one were my fault.
Okay. Sometimes there's, if you've had whiplash or something in your neck, sometimes there's a pinching of a nerve, and that nerve pinching can
I was
cause
knocked unconscious both times,
the tinnitus.
and they didn't check me for concussions or anything.
Can you talk about vertigo, or is that the same?
vertigo and dizziness kind of go hand in hand. Some people, it's just kind of a term that people choose to use.
Like if it just suddenly happened, like sometimes you're sitting and you just have a wave of it, what's it all about?
Mhm. Well, that could be any of those factors. It could be that you're dehydrated. It could be, if there's not a problem that started it, it could be,
It can be a result of drinking too much too.
it could be, yes, absolutely. Drinking, alcohol.
Drink alcohol.
Sometimes too much caffeine can be too much of a stimulant, and that stimulant can cause the room to spin a little bit.
The few times I've had it very few, I think February in my lifetime, I would wake up in the morning without getting up, and I would feel like the room was spinning. Is that connected to water and all that?
It could be dehydration. It could be effective at a medication that you took the night before. If you took a medication at bedtime, it could affect you when you wake up in the morning. It could possibly be an inner ear problem with those crystals and the level. Usually people, when it's an inner ear problem, like I talked about with the level, usually it's with movement. So either sitting up, going from sitting to standing, going from sitting to lying down, and you might have felt like you just woke up and you were dizzy, you might not have realized, but rolling over in bed can also trigger that. If you have trouble with your inner ear, it could cause vertigo. So it might have been you woke up and rolled over, and it seemed like it just came all of a sudden. It could have been from the rolling over. If something resolves pretty quickly, if you're able to lay there a minute or two or sit there a minute or two, and it doesn't happen on a regular basis, it probably isn't a big deal. It might have just been you were dehydrated. As long as it goes away, it's